you for Chairman. COVID-19 pandemic has been changing the world. In 2019 September, I went to Venice for inner ear biology. San Marco Square was very good, happy face. But I noticed someone stole my wallet, 100,000 yen. But the next day, unhappy face. I noticed Venice is a little bit dangerous. Japan is safe. But I want to go to Cyprus. I'm otolaryngologist and psychiatrist, double license. It's like hybrid car. Then we perform otolaryngologic exams and psychiatric exams simultaneously. My otolaryngologic exam started since 2005. I got first otolaryngologic license, then I got psychiatric license. My topic is tinnitus or auditory hallucination and sound therapy. We show the two cases report about the patient with schizoaffective disorder with treatment refractory auditory verbal hallucinations. Who were successfully treated with sound therapy, which is effective to treat tinnitus. Is sound therapy effective for auditory hallucination? We show how psychiatric comorbidity in patients with tinnitus is. How is the difference between tinnitus and auditory hallucination? Sound therapy was effective for tinnitus and antipsychotic were effective for auditory hallucination. About tinnitus, Professor Ogawa in Keio University shows this figure and he said pain network in the brain was important. On the other hand, auditory hallucination is dopamine D2 receptor abnormalities in the brain, like schizophrenia. But I noticed that auditory hallucination was a possibility of false recognition of tinnitus. A renewed psychiatrist said there is some risk of auditory hallucination in people of hearing loss. There is some relationship between tinnitus and auditory hallucination. Auditory hallucination is sometimes similar to tinnitus. Tinnitus was associated with psychiatric disease, brain disease. Sound therapy could be effective for auditory hallucination. The subjects were 342 patients with tinnitus and 24 patients with auditory hallucination. Patients were diagnosed as otolaryngologic disorder and a psychiatric disorder using ICD-10. Our hospital started 50 years ago. He is President Yoshida, second generation. He is an executive director of the Prefectural Medical Association in charge of COVID-19. Otolaryngologic exams are started since 1994 by 73-year-old Ineti doctor. Nobeoka is very countryside, far 1,000 kilometers from Kawagoe Otology Institute. Professor Hideaki Sakata, next vice president. We show the result. Psychiatric comorbidity is found about 80%. It is higher than dizziness, 70%, but auditory hallucination is 100%. We show the psychiatric disorder in 264 patients with tinnitus. Various types of psychiatric disorders were found. Anxiety or panic disorder, 46%, mood disorder, 25%, like case 1. Organic mental disorder, 7%, like case 2. Schizophrenia, 4%, like case 3. We show the 24 patients with auditory hallucination, schizophrenia 88% like case 3, organic mental disorder 8% like case 2. After COVID-19 pandemic, hearing aid company marketeers staff could not enter a hospital for the rule of infection control team, ICT. We show outside hearing aid consultation. Hearing aid consultation, they decreased 6 to 2 times a month. In summer, cicada noise was terrible. It's very hot to wear protective suits. There were tent installation, but very hot. But in winter, it was very cold. We show 3 cases presentation, such as 1 case with tinnitus and 2 cases with tinnitus and auditory hallucination. Case 1 was 56 years old man, hearing loss tinnitus using hearing aid. In 2003, his voice suddenly echoed in his head. At the same time, the surrounding town echoed like jin jin gan gan. Receiving various treatment but maintained unchanged. First visit on February 2009 at the Department of Otolaryngology, Nobeoko Prefecture Hospital. He took clonazepam and carbamazepine. He always had medicine, but the medicinal effect was short, and he got sick when he took it. He had depressed mood, anxiety, and frustration. He had a fight with the doctor. He wanted to shoot his head with a pistol and died. Pure tone audiometry, PTA, was here, and speech discrimination score, the SDS, was here. We show THI score was 80 points at 4 years after treatment. I think THI score was 100 point full score at first visit. Diagnosis was bipolar disorder. The treatment were collaboration with the Prefecture Hospital Otolaryngology treatment of tinnitus, mental care for suicidal ideation. We prescribed olanzapine, antipsychotics, and paroxetine antidepressant. He continued to take clonazepam and carbamazepine. We show diagnostic criteria for depression ICD-10. Depressed mode, increased fatigue, loss of self-confidence, and loss of concentration were important. But it is difficult to find whether a patient was the bipolar or not. When you doubt the bipolar, Dr. Takashima advised me 5 points is important. Bipolar family history, cyclothymia, young onset, mixed state, it means depressive and manic state, rebound depression episode. I think irritability, verbosity, aggression, high tension are important. We have to understand the bipolar spectrum disorder. If the patient has the bipolar, we did not recommend the use of antidepressant alone. We need mood stabilizer or antipsychotic. Was 83 years, woman, senile, psychosis, mixed state. She went a lot of clinic. She had auditory verbal hallucinations. Shiroyama no kane ga yoi yoi. THI score is about 100 point full score. After hospitalized, she got well, but unfortunately, she said she was killed by Yoshida Hospital. She drank detergent and vomited. She went ER and another psychiatric hospital. We show her PTA. THI score get well from 100 to 2. Auditory Hallucination Handicap Inventory, AHHI, which is revised version of THI, was used as an evaluation method for auditory hallucinations. AHHI are very useful. AHHI score get well from 98 to 0. We show her drug therapy and sound therapy. She took 3 sleep medications and 1 antipsychotics, quetiapine. Her hearing level was good, but she used both sound mode and hearing aid mode more than 8 hours a day. Case 3 was 67 years woman, schizophrenia, cognitive dysfunction, depression, tinnitus. She was trying to make burning of the bath her husband's driver's license. She came to our hospital. She muttered to herself and had paranoia. Her diagnosis was schizophrenia. Her husband decided to divorce, but it was recommended a psychiatric consultation. She had paranoia, irritability, psychomotor agitation. She was hospitalized. First, she took risperidone. Then she had depression and took milnacipran. Her HDSR is 12. She took galantamine. For treatment, she took Aripiprazole, long-acting intramuscular injection, LAI. Her HDSR improved 28. In 2017, she hoped to treat by sound therapy. Her HDSR improved 28 from 12. We show her PTA results. THI score get well from 32 to 10, and in May the THI score was 0. But HHI score get bad from 38 to 44, but in June, 0. We show her drug therapy, Aripiprazole LAI, was effective. It was monthly injection. It has less side effects and good antipsychotic effect. Her hearing level was good. Then she used sound mode only. Aripiprazole was very unique antipsychotics. It's called dopamine-system stabilizers. When dopamine nerve were hyperactivity, stabilizing. When dopamine nerve were hypoactivity, stabilized. Very useful drug. The 3 cases received otolaryngologic treatment and psychiatric treatment. Collaboration treatment was effective. Conclusion. Thank you very much.